Welcome. Have you ever heard of early repolarization syndrome? It's a heart condition that often shows up on an EKG, but isn't always cause for alarm. In this video, we'll delve into the details of early repolarization syndrome, exploring its causes, how it affects the heart, and what you need to know. The exact cause of early repolarization syndrome is still being researched. Experts believe it's likely a combination of genetic and environmental factors. Some studies have pointed towards specific gene mutations that might predispose individuals to developing the syndrome. However, it's important to remember that many people with these genetic variations never experience any related health problems. Early repolarization syndrome affects the heart's electrical activity. Normally, after the heart muscle contracts, it needs to repolarize or reset to prepare for the next beat. In individuals with early repolarization, this repolarization process occurs earlier than usual in certain areas of the heart, particularly the lower chambers or ventricles. This early repolarization creates a distinctive pattern on electrocardiogram, an EKG, often characterized by a J-point elevation or slurring at the end of the QRS complex. Early repolarization is fairly common, showing up in EKGs of between 1 to 13% of the general population. It tends to be more prevalent in younger individuals, athletes, and males. While it's often considered a benign finding, it's crucial to understand that, in a small subset of individuals, early repolarization can be associated with an increased risk of sudden cardiac arrest, particularly in those who have other risk factors. Most individuals with early repolarization syndrome don't experience any symptoms. The condition is often discovered incidentally during a routine EKG or during testing for other health concerns. However, in rare cases, early repolarization can be linked to heart rhythm problems, such as ventricular fibrillation, which can cause fainting, dizziness, or even sudden cardiac arrest. Diagnosis of early repolarization syndrome primarily relies on an electrocardiogram or EKG. Doctors look for specific patterns, such as J-point elevation and ST segment elevation, particularly in the inferior and lateral leads of the EKG. To determine the risk of dangerous heart rhythms, doctors also need to consider patient's history, family history, and other factors. Further testing such as an echocardiogram or stress test may be needed to rule out underlying heart disease. Early repolarization syndrome isn't classified into distinct types in the traditional sense. Instead, the focus is on risk stratification, assessing the likelihood of a patient experiencing dangerous heart rhythm problems. Certain EKG patterns, such as inferior or widespread early repolarization, along with clinical factors like a history of fainting, can indicate a higher risk. In many cases, early repolarization syndrome requires no specific treatment. If it's discovered incidentally and the individual is asymptomatic with no other risk factors, regular monitoring may be recommended. For individuals at higher risk of heart rhythm problems, treatment options may include medications such as quinidine or other antiarrhythmic drugs, or in rare cases, an implantable cardioverter defibrillator or ICD may be necessary to prevent sudden cardiac arrest. Since the exact cause of early repolarization syndrome isn't fully understood, there's no definitive way to prevent it. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding excessive alcohol consumption or drug use, can promote overall heart health and may help minimize potential risks. The prognosis for individuals with early repolarization syndrome is generally good. Most people with the condition will never experience any related health problems. However, it's essential to have a thorough evaluation and risk assessment by a qualified cardiologist to determine your individual risk level. Recent research is focused on identifying specific genetic markers and EKG patterns that can better predict which individuals with early repolarization are at higher risk of sudden cardiac arrest. This will allow for more targeted interventions and improved patient outcomes. Thank you for watching.